Hello, my name is Jordan Petaway. My research article presentation is on an article called Comparative Two-Dimensional Polyacrylamide Gel Electrophoresis of the Salivary Proteome of Children with Autism Spectrum Disorder. Below I have listed the authors of this article. In the past few decades, the diagnosis of autism spectrum disorder has increased. Autism is compiled of a group of neurodevelopmental heterogeneous disorders. Indications can include impaired verbal and nonverbal communication, impaired social reaction, and rigid patterns or behavioral interest. The exact etiology of autism spectrum disorder has yet been discovered, and methods for early diagnosis are still needed. This article discussed ways to discover potential biomarkers that are present in patients with autism. The methods used for the experiment was a two-dimensional polyacrylamide gel electrophoresis and a nanoliquid chromatography tandem mass spectrometry. These tests were done to compare salivary proteome profiling of children with autism and compared to their controls. Two-dimensional page is used to identify useful proteins and protein isoforms. Coupled with mass spectrometry screening, these offer many advantages and is a common proteomic approach for screening biomarkers. The biomarkers can give way to the downregulation of increased expression. The biomarkers can give way to downregulation or increased expression of certain proteins that have been previously linked to autism or are known risk factors from a genetic standpoint. These efforts were done for possible advances in early diagnosis, prognosis, and treatment response to autism. Using two-dimensional page, protein spots of interest were picked and extracted based on fold increase. A decrease of greater than or equal to 1.7, the p-value below 0.05 of a fold increase, or a decrease of greater than or equal to 3.0. The excited spots were then identified using the mass spectrometry. I have a picture of the role of biomarkers and how they can be used. I will talk about it compared to my article about autism. So the patient in our case is a child who has autism. The blood or tissue specimen we used was saliva. Molecular analysis and data analysis was done using the spectrometry and the SDS pages. We then identified the biomarkers, which in our case were proteins, to give us information. And then with that information, we're trying to figure out therapies and just overall new information concerning autism. So my first figure, this figure is the 2D page gels of the saliva samples from the control and the autism samples. In the autism samples, some spots in the autism sample, some spots diminished and decreased in size when compared to the control samples. This can show the downregulation of certain proteins concerning autism spectrum disorder. So if we look at my pictures, this is the autism and this is the control. As we see, the spot is kind of diminished and it's gotten smaller. You see the big spots. Here also, it's a little bit smaller compared to here, right? So these would be spots that would be excised from the gel. In this figure shows the two-dimensional gel of average autism spectrum disorder versus typically developing. The blue and red circled spots are polypeptide spots. Polypeptide spots increased in autism spectrum disorder versus control are outlined in blue. White spots decrease in autism spectrum disorder versus control are outlined in red. A collection of pooled samples usually used in cancer biomarker research deemed helpful in being a rapid screening method for evaluating the possibility of finding markers in biology fluid, such as saliva. Although this approach is helpful, since autism is a known heterogeneous disorder, other individual comparisons are needed. The mass spectrometry in the two-dimensional page shows statistically significant differences in many proteins. Studies like this will continue to contribute to protein signatures for autism, risk and subtypes, and advanced understanding of autism cause, as well as provide novel treatment targets for autism. Here I list the reference of the article that I used. Thank you.